Welcome to the Cambridge Tech Podcast, talking all things technology from the heart of the UK's tech capital. Here are your hosts, Faye Holland and James Parton.
Welcome to Cambridge Tech Podcast. I'm James. Faye is taking a well-deserved break and will be back soon. So this week I had the opportunity to show my face around Cambridge, which has been really nice. IE Cambridge organised a session for the University Enterprise Network to hear more from organisations in the Cambridge ecosystem. And I was very grateful for the opportunity to talk a little bit about the Bradfield Centre and the podcast. In fact, I counted at least 4 previous podcast guests in the crowd. I also had the opportunity to sit on the judging panel for the East of England regional final of the KPMG UK Tech Innovator competition. A really strong lineup, which made things really hard for the judges. And a quick shout out to everyone that participated. So that was Biodoc, Deep Mirror, Hot House Therapeutics, Hooten Bio, Shuffle Energy, MindBloom AI, Monumo, Oasis AI, and eventual winners, Matnex. Congratulations to them. We've actually spoken to Hooten Bio and Monumo previously on the podcast, so check out episodes 81 and 59 respectively to learn a little bit more about them. Okay, let's move on to this week's local tech news. Now, we've been discussing Cambridge Wide Open Week a number of times, but thanks to Business Weekly, we have a couple of data points to share. So more than 200 events were held during the week, attracting over 4,000 attendees across 20 venues. A real kind of tribute to the organisers O2H and the cluster's innovation ecosystem. Prashant Shah, CEO of the organising O2H group, commented, "What started as a one-day event has now evolved into an interactive festival celebrating life sciences at the home of life sciences for the whole week. Cambridge Wide Open Week is a community-driven endeavour that reflects the energy of our buzzing ecosystem." And you can listen back to previous interviews with Prashant in episodes 40, 87 and 137. Next up we have Keegan, an IoT startup which originally spun out of Arm, which has announced an unspecified strategic investment from the SBI Group, one of Japan's biggest financial services and investment groups. Keegan has spearheaded the industry's move to the new GSMA eSIM standard, and their technology simplifies how connected devices are deployed across regions, offering support for global connectivity straight out of the box. Okay, let's move on to this week's interview with Nazmus and Raoul Peltier, the co-founders of AnthroTek.
Okay, so we've been looking forward to this interview for a while because we've both bumped into you at various events and we've been very excited of what we've learned in those kind of conversations over coffees and drinks. So why don't we start by first getting to know you both? Nazmus, do you want to kick us off with your kind of background and how you got to this point?
Sure. Well, I had a background in law. I did corporate and financial law, and then I happened to find Raoul in some ways. He will probably tell you more about that. So after doing law, I went into venture capital scene and worked with startups, and I have been active within startups for the last 13 years. Did a few business. Some of them worked out, some of them didn't. And so my background, predominantly law from academic side, and startup-wise, I have done from manufacturing business like glass manufacturing company in South Asia to a soft tech, and also I have worked with people who have been working with robotics, medical science. So yeah,
and was
so
it's a very studying that brought you to Cambridge, or?
Yeah, study brought me to the UK. So I was born in Bangladesh, and then I came to the UK back in 2009 to do a law degree. And I did that in Nottingham. I did my undergrad there, and then I did my postgrad in Oxford University. I did a course called BCL. And after that, basically went into the profession, not legal profession, but basically on the side.
Cool. And Raoul?
Yes, so me, I'm the scientist of the duo. I used to be an academic for about 12 years, working on novel material for drug delivery, mostly nanoparticles. And then after I moved to biotech, where I was head of DNA synthesis in a company called Robotics. You may have heard of it. So that's my background. On the side of my scientist job, I always had this hobby of doing silicone initially masks and prosthetics in my garage. So I had a big workshop in my garage where I was doing this initially for fun, a bit later for movies. And this is basically, we are now with AnthroTek, which is a silicone/science company.
So we do have a garage to startup story to tell in this episode.
I think
Fantastic.
so, yeah.
I love it.
So let's talk about AnthroTek then. Coming from the garage, you had these silicon solutions that you've now turned into a business looking at how can you develop for medical simulation and robotics. So was it literally your idea out of the garage? Was it the pairing of the two of you to say, let's turn this into a venture? How did that journey begin?
Yeah, the journey is quite interesting, and it's definitely the combination, the synergy of us both. But like I said, so I had this hobby of doing the silicone in the garage, and that started to pick up a little bit. I built a website. I started to sell to some small music bands, then slightly larger bands. And then one event that kind of changed everything. I used to live in 6 Mile Bottom in Newmarket, and it's a very remote area, so there's no taxis there. And one day I wanted to go to a birthday party, so I didn't want to take my car. So I made a sign that says Cambridge £10, and I went on the road hitchhiking. And yeah, the person who gave me a ride that day turned out to be Julian Spencer. So for those who don't know Julian, he's the largest stunt coordinator in the UK. So he worked on all the biggest UK movie productions like James Bond, Peaky Blinders, Saving Private Ryan. All of them, he coordinates the stunts. So obviously we talked during the ride. The day after, I went back to his house and I brought him a silicone finger for his daughter's birthday. A bit of a weird gift, but he really liked it. And next thing you know, a few weeks later, I received a phone call from him asking me to make 2 masks for 28 Years Later, which is one of Danny Boyle's movies, so one of the biggest UK production this year. So that was a turn of event.
I mean, we talk about serendipity on the podcast all the time, but this is ridiculous.
This is
Hitchhiking led to your
ridiculous,
company.
It's a good story, right? And I guess, well, the other turning point, obviously, is at some point my company, so where I was working, Evonetics closed its door while I was actually making these masks in my garage. So it's quite a funny timing. So I guess at this point I had a choice, either continue with my cushioned career as a scientist or take a leap of faith and explore my passion. And it's exactly at that time that I actually met Naz. Do you want to take it from there?
Yeah, we met in a punting in Cambridge. So he just basically left his job.
Fabricated.
No. Literally, he left his job. It's quite funny, and it seems interestingly how all of this came together. So I had this offer from 2 other founders to join the team, and it was venture funded. A great team, great work to do with the hardcore tech product. So I was in between thinking, should I join them or should I do something? And then I met Raoul. We organized a punting day, and we knew each other from before. So Raoul told he's working on something quite interesting. I'm like, what are you working on? And then he told me about work that he was doing for the director. And that was quite interesting for me because I come from a bit of creative background. I found that fascinating. And what I really liked is him being a material scientist, doing artistic work. But because I had some interactions with people from medical and robotics industry who I knew that they would need some of the expertise that he has, which he was doing for movie in his garage. So we started having a conversation. I invited you for a lunch, I think, after he told me about the movie work. I invited him for a lunch. And then who paid for the lunch?
I can't remember who paid for the lunch.
And then we had this conversation about where this could go. Immediately we felt potentially MedTech or perhaps doing something with the medical and robotic side could be interesting as we also explore the cinema side of the business. So the AnthroTek idea came out of that, sort of do something that is human-like tech. What can we do that mimics a human in an artificial form, but also provide tools and mechanism that is needed for medical innovation or perhaps for the new phase of robotics, and can we bring all of the knowledge that we have from cinema into this? So that was sort of the initial rough mental idea that we had.
Yeah, how we started, at least.
it's kind of really interesting, isn't it? Because you came from nowhere, and then all of a sudden it was, the film stuff, and then you popped up at all of these different events, and actually you really did just come through. It was just like James says, one of those serendipitous collisions of a couple of people, and then crafting an idea out of it. It's great.
Yeah, I think Cambridge ecosystem has a big role to play for that, for those kind of interactions to happen, actually.
I think a lot of people we met they contributed a lot to our fast success. And also we just arrived in a niche market at a moment where nobody else is kind of doing what we do. So it seems right.
Let's come on to that a little bit more.
Yeah, well, let's spend a little time talking about the products. I mean, you've talked about their silicone. You started with masks and prosthetics and stuff, and now then the kind of opportunity around medical. We're actually sitting here, and on the table in front of us, we have a rat and we have a lung. And we're not going to do it justice because these things are hyper realistic, and we will take some photos and put them on social. So yeah, talk us through, the product design process. Are they 3D printed? Are they molded? Talk us through the product side and the technology side.
Yeah, so we offer different type of products. Some of them are look like hyper-realistic. Some of them are look like, feel like. Some of them are medically accurate. And the way we produce them is all based around 3D technology. So we'll use 3D modeling and AI to create the design of each product. And that is based around, a bit of literature research to get the right medical measurements, the way, the shapes. And usually we have, at this moment of the process, a bit of back and forth with the customer so they can review the designs and suggest changes. Then after we move to the production phase, so that starts with 3D printing. We either 3D print the molds and then cast our various silicones in there, or we can 3D print directly the soft materials. And this is something we're moving more and more towards. And then from thereafter, there is a bit of an artistic phase where is the hyper-realistic painting. At the moment, all of that is done by hand. So we've got a couple of artists in-house. I think, that summarizes sort of the process.
Also, where it is going is that the work we do currently are very niched work that solves very difficult problem for particular company or particular innovators who needs that kind of solution. As we do that, as a company, the way the investor got really interested, we also retain the IP of the solution that we built. So the idea is if these solutions that we're building is workable in a particular situation, we can then scale that up. The current production or the current 1 year, less than a year, I think 8-9 months of our operations, it has been more like you could think of us as a prototyping studio for solving problems for, let's say, medical industry. And as we do that, we are also gaining all of those IPs, and some of the products we will then place and scale up those. So that's sort of the value proposition that comes from doing very niched work for 1 or 2 clients, but then can we then place it for hundreds of clients doing the same thing? So that's sort of the bridge.
You can tell you've been asked how do you scale this by investors a few times.
Oh, yeah, this is because exactly that is a big concern as a business, right? You can do something which is amazing work for 1 client, but if you cannot do that for hundreds of thousands of clients, then it's really hard to justify a difficult work where you're inputting scientific expertise, you're putting so much time, and especially when you build a business in Cambridge, the overhead cost, one of the biggest component is the people and the time cost. So if you design something, build something, it has to have a scalability. Otherwise, it's hard to keep the lights on in the business. Yeah.
So before we move off the product question, talk more specifically about the robotics side of things then. So are you effectively creating kind of like sleeves that go over robots to give them that hyper-realistic?
I can maybe start and then...
Go for it.
When we're thinking around robotics, we started with this idea what the market might need. And very early on, because we're specialized with hyperrealism, so we thought probably it's the hyperrealistic thing that people want for humanoids or new phase of the humanoids. And some of the work we did for medical, we immediately saw like we could translate that expertise into robotics. Like we did some work with the skin, human skin, characterization of that. So we could see that there is a transition. But as we looked into the market, we were in the Robotics Summit a couple of weeks ago, and we started talking to like hundreds of people there. And we realized that the niche and the demand is not for hyperrealism, but it's for functionality. So the work we do with robotics is the soft materials that we specialize in. And then we're trying to understand how those manufacturers could use our materials to do the things they want to do. Is it the grip they want? Is it
basically just making skin that looks good is not good enough for the robotic industry. So it needs to be a skin that has a mechanical accuracy, so that behaves like human skin. That seems to be quite important for them. But mostly it needs to have specific properties. And from talking with the robotic market, we kind of isolated 2 properties that would be pretty good for them. The first one is to make it smart. So that means embedding sensors into the skin, whether that is sensors that can sense, the touch or quantify the touch, or whether it's sensors that can quantify temperature. All of this, brings a lot more value to the skin itself. And for this, we have a collaboration with a soft sensor company called TG0, where we co-explore the development, of our skin and their sensors fused together. The second way we can make the skin useful is antibacterial. So think of like all the things that a robot, either in healthcare or in a house, would touch with his hand. And then would you let the robot make your sandwich after that or change your dressing of your wound? Probably not. The concept of a robot that washes his hands is not really a thing that is applicable. So in all of that, a antibacterial coating to the silicone skin, something that will immediately kill the microbes or bacteria as they land on the surface, is of high value. So these are 2 things we explore. The antibacterial is more sort of academic
also, with
based.
antibacterial, there is a really niche demand for that we figure out from prosthetic side, especially people who lost their limbs or organs. We saw a lot of demand in designing prosthetics who has microbial properties. So where we plug in as a company is being an advanced material company. So although we started from cinema and all of these things like a year ago, but where we've started finding our niche and our real expertise is that Raoul is a material scientist with PhD in polymer chemistry, and our CSO, Paul, who is also a material scientist. So we have this amazing 2 material scientists in the team. So we felt like, what can we do to piggyback that expertise and then sell that expertise to people? And we figured out it's the material expertise that we have around silicon and around soft material that is probably the value proposition that we bring to the table. So for robotics, so that's what we are trying to do. That's where can we go with this expertise? And then whatever the market needs, we will resonate to that.
Yeah, and that's got to be a challenge though, hasn't it? And I know you're still very, very early stage. We've kind of in a very short amount of time talked about movies, talked about surgical training, prosthetics, robotics. And actually, once your brain gets into that zone, you're then starting to think of so many more applications. So focusing on material expertise makes really logical sense. But how do you then go to market? How do you scale that? You've got to narrow that market down because it's way too big. So do you know that? Do you instinctively have an idea in which direction, or is it still a little bit too early for you to hazard a guess?
In a compliment. I think we have a 2-stage approach. So the first year, it was an agreement that we made with the investor that would be probing markets. So we literally started with a lot of ideas and we didn't know which one was going to work. So we went out, explored all these markets, and now we have got a much more refined idea of what is actually in demand. And from there, we will very soon enter stage 2, where we really refocus the company into what works. We found some stuff like artificial skin that's very high demand. We will refocus the company and scale up on those items that work really well.
Yeah, and think about the skin as an example. I will tell you how it all connects. So the skin that we developed and currently being used in the US for medical studies, it's a skin that mimics human skins. And this is a product we already designed. It's already out there. We have expertise and knowledge about how to do this, right? And as a business, as a startup, we're also thinking, we can do this today. What can we do it in 3 months? What can we do it in 3 years down the line? And we are thinking, how can we improve this as we go along and scale, and where the market will be, not today, but where it will be tomorrow, day after tomorrow. So the work that we're doing is they connect with each other. This human skin connects with understanding the tensile strength, understanding how it behaves in a human body. And as that you understand, the immediate focus is then how can we implement that into a prosthetic limbs? If we can implement that into a prosthetic limbs, can we then implement it to a humanoid robotics? Because upper torso is a huge demand for robotic industry. So for us, it's a story that connects in one thread. It's not we're trying to different things. We're basically trying to figure out, as my job is to do the business development. So my job is, in a way, the company is that trying to understand where we might find our market that we can really scale. So the base, or from now till Series A, which is pre-seed to Series A, that our target is to sustain as a company and find that out. And as we do, we are actually developing a lot of IP, which is quite interesting because we were developing IP around the process optimizations that we have done. We have already got some chemical breakthrough, actually, how to work with soft material. Raoul and our team has got that. So as we are doing that, we are also designing this almost a library. So that's, to us, that is very interesting because in long run, this will give us an understanding of where we should go. But again, think of almost like an onions. So we have our core is connected to the material science expertise. And after that, we have different layers, and we're going to keep peeling it until Series A. And once we go there, we know that this is where we're really focusing on. So we're still going to take time to focus our 100% energy, and we're going to keep our mind open.
Do you have like a gut instinct as to which way you want it? Because as soon as the investors get involved, then the likelihood is they're going to say, okay, we're interested in humanoid robotics. You know, that's the direction. And then therefore you may or may not be able to do the prosthetic limbs. You know, is there a direction that you personally feel passionate about?
Well, I think passionate is a different question from where we might go because of economic. But in terms of passion, I think we both agree that sustainability is a big topic that I would like to address at some point. Currently, in terms of silicone, all the silicone that is produced, whether it's manufacturing, so your gaskets, or whether it's medical, so all your tubing, catheter, or even the cinema industry, all that silicone is going to the landfill. There's no way to recycle that. So we are really interested into using our material science knowledge to really explore, can we find within 5 years a alternative to silicone that is actually biodegradable. That's where our collaboration with the University of Warwick, we have there a advisor, which is Professor Sébastien Peltier. He's one of the leading researchers when it comes to developing novel polymer. So we have this collaboration with him, and we're currently applying for a PhD student to start working on this. It's a very complex topic. It's much more suited to academia at the moment than it probably is to R&D within a company. So we plan to use that and co-develop, hopefully, an alternative. So that is where the passion topic.
So the passion is, the long-term passion is definitely building a company that finds the applications of a sustainable material. And as we do that, definitely we are now we are going as the customer demands at this stage. So we found out very early on that movie industry work is not commercially as viable as medical innovation work. Because if you are a medical robotics manufacturer, let's say like CMR Surgical in Cambridge, they're going for funding after funding, and they're doing a hardcore innovation with surgical robotics. They need simulation tools they can test their robots in. And that's an exciting field for us because the client is better, the client pays a lot more, they're willing to do that. And also we find an extreme amount of joy doing this kind of work because we know the impact is saving lives. Like we send a medically accurate organ to one of the company in Oxford, and we know that is going to go into a transplant device which people will train on. And for us, that is humongously satisfying. So I think there is that mental satisfaction of doing medical work that we do. And well, we both love science fiction. So there's also a satisfaction if we could do in future something to do with robotics. That is like something I could talk to my mother and be proud about, things like that. So there is that aspect as well, like childish aspect when you think of humanoids. What can we do if our prosthetics was someday in some humanoid hands that is in people's home. That would be quite interesting for us, right?
Yeah.
So that's there. But sustainability doesn't, everything we do in the core that we started thinking about very early on when we named the company AnthroTek is like, we should do human tech and make it more sustainable for human and more human and humane both.
I mean, it must be so exciting to go to work every day because you really are right in the middle of a whole bunch of different exciting opportunities, aren't you? And I guess it's like you alluded to when you were describing how you select which projects to work on, because you're obviously, you have obviously seen the investor community, and they have a standard set of questions about scalability and focus and distraction kills startups, but it's clear why you're doing what you're doing at the moment. You're kind of doing market discovery. You're experimenting. Everything is connected by progresses the R&D side of things. So you're creating IPs. That all makes total sense. So, I mean, let's switch then to talk about the company a little bit. So, whilst you're in this phase, are you financing through the projects you're developing? Have you already raised money? Or what does that look like as you start to grow?
We're already generating money, but we're not positive in revenues. So we have already gathered pre-seed funding. We had 200K back last September. And again, the agreement with the investor, we're really lucky. The investor was on board to use this money to explore the different markets, which we have done. Currently, we're raising our seed round. So we are now looking for 1.5 million. Of those 1.5 million, we've already raised 950K. So we are about 60% of the way, and we currently raising and then looking for investor for the rest of the money. But we are hoping this money will be around like 2-3 years and will bring us to a place where we are positive in revenues, because we are currently generating a fair amount and it's increasing every month.
And where's that money coming from? Is it like medical device investors? Because to your point, I guess, is there a concern that depending on where the money comes from, it might shut down some of these opportunities to experiment?
So we were very picky about investor choice because I had a background in early stage VC firms. So we made a very concise decision in the early on that we need to have investor startup fit. So keeping that in mind, we brought in angels who were willing to support us for doing what we want to do. And it's a family fund. They had experience working with 3D CAD softwares and they understood us. They understood what we are what we want to do and achieve. So they were very happy for us to explore that. And also when they contributed to our current round, they're also very happy for us to explore this. Definitely there is a need for us to find our focus, which is ultimately every time you put some money in, you want the business to find the focus. So we have been lucky so far that we haven't brought in VC or institutional investor yet. And we know that when we go for that, we should be mentally ready to know where we are going to scale super fast and what would work super fast. So currently, medical seems to be a way that
Currently I would say 80% of the revenues come from medical and 20% come from the cinema industry. We haven't really sold a lot of robot skin at the moment. We're just in the R&D phase for that. And to be honest, exploring the market, there's not a lot of robots being sold at the moment. They are being developed.
That's real cutting edge stuff.
Cutting edge, So the work we're doing now, we'll probably see especially with the skin tech we're developing, we will have sensor embedded skin within next month being shown in Amsterdam. There is a health show, but that is for health tech. But as soon as we show that, we think next phase is for us to go there. So we are prepping ourselves for long-term innovation. Yeah. And we're in the very early stage of that. So everything helps. Like we won an IP award. We know that we have to protect our IP as we're doing those. So all of those will become useful for us. Yeah.
So we talk about all tech on this podcast, but we've never, ever heard of skin tech before right now. So you heard it here first. So thank you for that. Earlier on in the conversation, you talked about being in Cambridge and being part of the ecosystem. So just tell us, I think first of all, I will say you have worked the system really well. You've been out and about. You've been, exhibiting at things, participated in competitions. You've literally worked it really hard. How has it helped you?
I think the key for us at the moment is assembling the right team and connecting with the right people. And in that sense, Cambridge has really been super beneficial to us. I'll give a few examples. The first one is our CSO. So we recruited our CSO, Paul Stanley, who not only has a PhD in material science, but is also a very passionate genius around 3D technology. So he's the one that's been within the company, the leading mind behind the adoptions of all these technologies. Another example I can give is, in terms of market and finding customers, as we starting to look everywhere in our network, who do we know that could help us? And that's when we met Louisa Harvey from Clarimed. And Louisa was really instrumental in our success as she was the first big customer to trust us. We did a few items for Clarimed, but within 2 months of being operational, they ordered our first multi-surgery simulation. So we're talking like an entire torso, abdomen, thorax with all the organs in there. So that for us, 2 months in, that was a very large contract to be in, and that really set us up on our path to where we are now.
So in my head, I haven't moved on from the kind of where do you focus question, but I can't stop looking at the rat. I'm now holding the rat for the people on the podcast. And you say you got a full body, a full torso model. What's the R&D time on creating something like that? How long does that take?
So the full body took us about 2 months to do, because the customer was really specific about what they wanted inside. So the phase of development and design was a good month and a week, I think. So 5 weeks, where we really just did a lot of literature research, look for the dimensions, the hardness of the tissues, the deformation data, and then model all of this into our 3D models, show to the customer, and then we had at least 3 weeks of back and forth with them. The production itself is a lot faster. I'd say for a full body, about 3 weeks. For a rat, it's a lot faster, just simply because the parts are much smaller. Yeah. We spent about a month to make that rat. It was a bit harder to get data for rat tissues and all of that. There's weirdly a lot less literature, but once you have the data, reproducing it is fairly fast.
No, thanks for clarifying that. So, I mean, you're still really early in the process to ask you questions about the lessons learned, but you're moving at a pace. So what insights can you share with the audience on maybe some of the things that haven't gone so well, some of the successes? What's that process been like so far? Do you say it's really been like 9 months?
Yeah. So we started the time when me and Raoul we met was literally this time last year. Mm-hmm. And then we formed the company and we got the funding in September. We found the place in October. We signed the lease, commercial lease for 6 years. We trusted the thing so much. So we signed the lease for 6 years with a three-year break. And as you asked about the lesson learned, the thing is, in the very early on, what I found and what we found, I think, as two co-founders, is minding the gap of our skills and expertise and then having this absolute trust to each other. And as we do in a small team, it's quite easy, right? When you have 2 people team and you know each other, you kind of can understand and you can put your trust into other person and see how that plays out. As soon as we go for hiring and bringing people, we have to be very careful about these things, right? So we have been lucky. And well, I would give a lot here to Raoul because he has this understanding of how to vet people well. So all the hires we have done, so far we have done well. But I know horror story of my friends who started companies and their company actually couldn't go far because of wrong hires, because of wrong founder dynamic. I think that is one of the biggest pitfall that happens. But here is the thing, like if we say we always agree, I think that would be a big lie. Because the idea is we both have very strong mindset and understanding on our own area, and there is going to be idea clash. And the beautiful thing happens when there is idea clash, because then you have new idea babies. And those new idea babies are what actually, I think, push the company forward. So we realized that very early on, I think.
Yeah, I would agree. Like learning to disagree with each other was very important and to talk it through. And
passionately disagree. Yeah. This is the thing. Because it's your baby, right? It's your company. You care about it so much. You passionately disagree.
It was a learning curve, but I think we've learned a lot.
Yeah.
I'm quite passionate about HR and all of related to dealing with the people. And that has really taught me a lot. I don't think I had these issues in the past where you really have to debate pretty strongly or decisions. And then that, I think we are fortunate that both of us are very open-minded to the other person's opinion. So we really listen, and we're also just really good at communication. I think you are very good. I don't want to blow my own trumpet, but I think we're both pretty decent at communicating.
Yeah, and I think it helps really, like, if it is not your first time business, right? So I remember 13 years ago when I did my first business. It was an architectural glass company, now employs 150 people in Bangladesh. So it's a big company. And when I first made it, it was the very first time ever I did any business. So that me and this me is a very different person because of all the pitfalls and learning. And I think Raoul has also gone through a phase of actual professional work within scale-ups and within academia. And then, so we both came with an understanding of what might always go wrong in the very early days. And I think those lessons, without that, would probably have a lot more clash. So we found it quite easy to slot in. And it probably also helped us because I am not a technical person at all. Like, his mind is technical, Raoul think technically. I'm not a technical person. I'm a business and commercial guy with a marketing twist. So, and he doesn't think like me. So we both can like trust each other and then see how it unfolds. I think the clash should be more if we both were doing the same thing, which I think in startup should never do, especially early stage. Founding team should never have both person can do the same thing. Then it's not valuable because you're not actually adding complementary value. You're like basically clashing with each other's, which doesn't often work.
It's that complementarity, isn't it, of the skills. And it just, when you were talking about that, it just reminded me of something that Peter Caroli always used to say, which is strong opinions loosely held. So you really have to fight your corner, but then you've got to be willing to listen to the other person, so you can, what did you call them? New idea babies? Yeah, okay. That's another new one. Love it. I mean, it's been absolutely fascinating. Thank you so much for sharing all of those insights. I would now like to look into the future. So you talked about things like sustainable silicone, those types of things. We're going to fast forward to you're well past your 3 years break clause in your lease. You're at the 6-year point. Where have you got to?
Yeah, that's a very difficult question to answer. I mean, we know where we want to go. So, like we've mentioned, robotics is one of the biggest markets we want to explore. It is currently a baby market in the sense that, like we said, robots are not currently being sold massively. But when they will be, which according to our market research will be starting in a few years, we would really love that our embedded sensor skin is in most of those robots somewhere. Let it be on gloves or faces. We've realized there's not that big a market potentially. Nobody wants robots that look very human. But the medical is never going to go away. So the medical is the bread and butter that we have, and we will double down on it rather than just switch away from that for multiple reasons. But one being simply, like you said, we actually love it. This is almost our favorite part of the job. In 5 years, I would anticipate we have worked with a lot of product as well to reduce animal cruelty. This is something we feel quite strongly about. And currently, there is very little alternative to dissecting animals. There is virtually no models of animals. So this is why we came up, with the rat. And we really hope that not only by making animals models, but by making very accurate human models, we can altogether get rid of animal testing. It will still exist to a point, but at least if we could work towards reducing it, I think we'll both feel very proud.
Yeah. So for me, definitely, Raoul kind of gave a breakdown on an overarching level, the work that we're doing from injectable pharmaceuticals to the things for lab technicians. All of this, to me, where it ties down is basically it's a work of a company who is really thinking about becoming more and more humane. And we're really focusing on what can we do, what can we bring, or even learning and understanding what we have from human body and human ergonomy when we think of what we might do for the robotics. So as a company, this is where we want to go. We want to stay as a company that really cares about it and think about it, and then think about what are the solutions that we can build for that, right? So as we grow in 5 years, 10 years down the line, we want to keep doing it and keep innovating. Like everything that you see in front of the table now, like these are already MVP product that is out there and people are using it, testing it, and these are going to go out at some point, right? So in 3, 4, 5 years, we know that there will be a range of product that will come out of our facility. And how that impacts the world and how that impacts the ecosystem, we will see. But from the core of it is we want to stay as a humane company that try to find solutions that can help
Doing something that we
people and planet. Yeah.
Interestingly, we have a clause in our contract with the investor that we're not going to go for army contracts or military-based contracts, because that would just go against the grain of the human aspect of the company that we're trying to implement.
I literally have got another 42 questions for you, but you'll have to come back on and we can go through that in more detail then.
Yeah, I was just going to say, we can't wait to track the progress of you both. I mean, you're both super impressive as individuals, the company, the products, it's awesome. So yeah, we can't wait to get you back on soon.
Thank you very much.
Thank you very much. Thank you for having us. And it's been a joy speaking to you both. And I'm a listener of the show, so I love listening to you guys. And thank you for having us.
Today's show was produced by Carl Homer of Cambridge TV and supported by our media partner, Business Weekly. The Cambridge Tech podcast is available on all major podcast platforms and on cambridgetechpodcast.com. If you've enjoyed this podcast, please give it a 5-star review. It'll really help others discover the show.